Finding problems? That's easy. They exist in every community. I'm Terry Springs, your host. We're looking deeper, and we are talking solutions, finding out how we all can make a difference. Now on Talking Solutions, we're going to find out about Silver State Health. In studio with us, the CEO and the Executive Director of Silver State Health, Ryan Linden. Thank you so much for coming in.
Thanks for having me.
Silver State Health, relatively new here in Nevada?
It is. Silver State Health has really been around about 2 years and 2 months now. We received our grant in late part of 2016 and opened the doors in May of 2017. And so we've been following our mission just the last 2 years now. We are a nonprofit healthcare center. And basically what that is it's your standard community health center. It receives some federal funding and mandated to treat the medically underserved population that might be experiencing some difficulties accessing the healthcare and navigating the oftentimes confusing system that we have. We exist as a nonprofit entity here in Las Vegas really to lift up that population and ensure they're served.
And there are a great deal of people who would fit into that population that you're
Just
referring to. I saw in some information about Silver State Health that you are an FQHC.
Yes, and what that stands for is a federally qualified health center. And that's kind of where the funding comes in and who our overlords are, if you will, and the people that come and audit us every 3 months and ensure that our quality is at the highest standard at a federal and state level. And so really that designation means to the community that we take extra time to make sure quality is the highest, that we have a board of directors who hires and fires me, who's actually 51% are patients of the health center. And so it's a really community-driven environment, and it really helps to maintain that it's community-focused and really mirrors what the community is always looking for.
That is an interesting approach, to have 51% of your board actually be
consumers and patients, yeah. So it really keeps the eye on the ball, if you will.
I haven't heard of that before. But Ryan, the situation here in Nevada, when it comes to available healthcare options, kind of dire as far as mental health services. Did I read somewhere that we rank 51st, Nevada as number 51, below somebody who's not even a state?
Yes. In spite of Puerto Rico's laboring system and hurricane relief, they're able to provide better mental health services than Nevada is, which is sad. And really why we've flipped the model of what a federally qualified health center typically does, which is serve primary care patients first and mental health patients secondly. We've kind of flipped that on its head and primarily served the mental health community and backdoored that health into the primary world. And so we're really here to address the primary concerns of Nevada, which at this time are really mental health, counseling, psychiatric needs, depression, anxiety, and all those sorts of issues.
Every time we hear stories about horrendous things happening throughout the country or throughout the world, a lot of times they add that little tagline in there. We believe it was due to mental health issues, or that mental health issues contributed to the problem. We're talking with CEO and Executive Director of Silver State Health, Ryan Linden. Silver State Health, you're here to serve populations that might otherwise fall through the cracks. But you don't just offer mental health services.
These health centers are really built on a model that we in the industry call integrated care, and really to the layperson could be called one-stop shopping. We really want to make sure that if you take the time out of your day to come visit us, that maybe we can provide not just one service to you in that day, but maybe 2 or 3 services. And so FQHCs like mine are really built around providing not just mental health care, not just primary care, but also dental care, all in the same building, so that maybe your physicians and practitioners can collaborate amongst each other, making the services cheaper and more effective and more higher of quality. And so we're really excited to be able to offer anyone that might come in our doors for depression to say, hey, when's the last time you've gotten your hypertension checked? And they go, oh, I'm dealing with depression. There's really no way I could ever go see a doctor. And you go, I've got one right here. Let's just go next door and complete that, what we call a warm handoff to the next provider to see how we can holistically treat that individual.
And I would imagine also, Ryan, that you see in many cases when you do get a patient in-house at Silver State Health, maybe they came to see a primary doctor, but you're seeing other clues that they may also have other needs. And when you referred to it as a one-stop shop, you might be able to, especially among the providers conferring with each other, say, look, I think we also need to take a look at this issue with our patient.
Exactly. And when practitioners are not siloed out into their own very specific specialty, they start to think a little bit more globally. And they start to say, hey, I've seen that symptom before. I know it's not in my wheelhouse, but Dr. So-and-so next door here is going to be all over this. How can I introduce you to here without sending you to a referral that you might not get to, hoping you'll catch the next bus to get there? How can we make that as convenient and effective as possible?
That collaboration sounds like it could be a big factor in your success.
I sure hope so. That's really what the model's built after, and really what data's shown over the last 30 years about how people receive the best, high-quality, cost-effective healthcare.
Ryan Linden is with us today on Talking Solutions, and we are discussing Silver State Health. Been around for a couple years, is a federally qualified health center. You guys provide a whole umbrella of different types of care to populations that might not have insurance coverage or might not have access. I also have read about Silver State to find out that you also offer services, for instance, bilingual practitioners, nurses, and therapists. A lot of times you have language issues with the people that need these health services.
Absolutely. And really what we're mandated and told to do is to remove all of these different barriers you've just mentioned to receiving care. When this organization started 2 years ago, it was really my mission, in order to differentiate ourselves from anyone else in town, to really take the onus to be the most culturally competent and aware health center. We want to make sure that all the different kinds of individuals that may come in are treated as an individual with the care and tact that's really necessary in order to be respectful to everyone. As such, we really recognize that Las Vegas has the privilege of being one of the most diverse cities in the country, and a large percentage of our population's primary language might not be English. And especially for the Hispanic community, it's important to be treated by people that culturally understand where you've come from, look like you, sound like you, and are able to communicate with your entire family in order to drive treatment to the place that it needs to be. So we've been really lucky to have 9 of our 17 psychotherapists are bilingual, and our practitioners in that environment for primary care are also bilingual. And so it creates an environment that they can feel at home and feel like there's a cultural center that's listening and being effective in that delivery.
It's inclusive. Definitely. Everyone has value. And Ryan, I also believe when we're talking about one of the services that is so important that's being offered by Silver State Health, the mental health component, some of these populations are somewhat resistant to pursuing mental health care. It's a weakness, something that they're ashamed of.
Absolutely. And a lot of our work is removing that stigma from being treated in a, I wouldn't say institutionalized way, but a way that's different than the communal way that they've been brought up and raised in. We see that a lot of Asian individuals and a lot of Hispanic individuals culturally are more used to being treated within their family. They don't take these issues outside. They see it as complaining. But if you're able to remove that stigma and recognize that 25% of Americans will experience depression during some part of their life, to let that go untreated is just letting yourself suffer. So it's nice to be able to break through some of these barriers with other services like primary care, the intensive case management that we're able to offer by finding people housing resources and food resources and job placement, clothing and things like that, to begin to open people up to a dialogue about how they're actually doing.
You got a lot of different services under the umbrella that is Silver State Health.
And we're trying.
Ryan Linden is the CEO and Executive Director, and among the things that you've got, the ways that you are able to assist these customers of Silver State Health with your nonprofit medical facility, you've got so many things under one roof. Primary care, you have the mental health services, the dental that you mentioned, some of the social services, transportation help, as you mentioned, food, clothing. It really is, as you described earlier, a one-stop shop.
Absolutely. And I think that's really the model. And that's when I think of a community center in my mind. I go, if you come in the door not even knowing what you need, is there some way that we can help you? To say, hey, I think I need some help. And with the team approach, we really feel like we have a staff member there for every different kind of person and every different unique need. And a referral network outside our primary and behavioral health care that allows people to be treated on a sliding fee scale as well for, say, OBGYN or radiological reasons or anything like that. We believe that having a network and by having all these services all under one roof, it really does increase the community's health.
Ryan, how do you feel Silver State Health has been accepted within the community since you came on the scene here a couple years ago?
I think we've been accepted great with open arms from the community, really. And it's all about spreading the word about these kinds of services. And a lot of people don't know, for good reason, It's because we have the least amount of FQHCs here in the entire country. So there's only really 8 in the entire state, while someplace like Miami has 50 in its city. And that's just one city. And so the community here is really unaware of the services that we're doing, but have embraced it wholeheartedly as they see us really reaching out to places that haven't been touched before.
Which is why we have you here on Talking Solutions.
Amen.
Filling everybody in on Silver State Health. You know, one of the things that you're mentioning about how a client may come to you and say, I'm not sure what I need, but I think I need some help. I mean, it could fall into a lot of different areas, but the fact that you are that one-stop shop, that one location, they can come in and say, I'm not really sure what I need, but I do need some help. And so being the inclusive, accepting place that you are with Silver State Health, I would imagine no one should have any fear of saying, I'm going to walk in and I'm going to talk to them. If they can't help me, maybe they know someone who can.
Absolutely. And I guess that's part of the stigma is a lot of people have gone through governmental agencies for help before, and it's not warm. It's even more confusing than they came in with. They're not respected, and their time's not respected. So sometimes there's some convincing when someone says, oh, it's a federal center. I've been through that before. I've been in the military before. I haven't been treated well there. I'm not sure if I trust you guys to come in here. But by flipping that script and really offering so many social services instead of just digging in with primary services, I think it helps to make people feel more comfortable to accept treatment where they are. It's wonderful to be able to come in to a health center and say, I'm hungry. And I say, well, are you sure? Maybe we want to treat you. But instead say, here's some food. When you're ready to come back, why don't you come on back? And after we gain that trust, then people really begin to open up, and I think the healing process begins.
So it's an easy place for someone to approach.
Absolutely.
As far as the prospective patient or client for Silver State Health, you mentioned, Ryan, that there is a huge number out there of people who either don't have the services, don't know where to go, don't have those providers, sometimes don't even have insurance, or have a lesser ability to pay for such services. You guys are nonprofit, and you're opening the doors and saying anyone is welcome. As we're having our discussion, is there any certain person who's listening who should look into this, who should at least consider making an appointment, stopping in, checking out what you've got to offer with Silver State Health?
I would say the center is really made for anyone who's experienced any more difficulty in the healthcare system than they ought to. Whether you're underserved, like many who are uninsured, or you're unserved, which means, man, the hassle of going to a doctor is just beyond me. I think I'm healthy, but I don't quite know. Well, it was too expensive last time I went there. Or, man, the wait was too long. The doctor never listened to me. All those sorts of issues can really be solved through centers like ours. And so while we primarily accept a lot of Medicaid insurance and a lot of Medicare for the senior population, we accept all commercial insurances as well and see a large basis of those patients as well whose deductibles may be too high. So they might want to just see a doctor one time to get some blood work because every service that we offer is heavily discounted at our center. It's definitely a free-for-all and welcome to everyone, and I think anyone can benefit from the services that we're able to offer much more than the private sphere can because we're funded to do that.
Where is Silver State Health located?
Silver State Health right now is located off the corner of Tropicana and Eastern at 2215 Renaissance Drive and 89119. We're building out our corporate headquarters in the larger center on Saharan Jones, which should be open and ready for the community in about April of next year.
Do you have the possibility of expanding out as you grow this practice with Silver State Health?
We're definitely looking to make it convenient for the community to always reach us and as such kind of be in the four corners of Las Vegas, if you will. And so as we're planted now in kind of the eastern side, we're looking to be in the Spring Valley, Summerlin area, as well as North Las Vegas. We've applied for a grant and our staff is very interested in serving the rural populations as well. As I see the lay of the land as far as underserved people, I think some of the most forgotten people are peoples that are found in the frontier cities, Pahrump, Beatty, Tonopah, Laughlin, these sorts of places where it's so hard to have any choice when seeing a physician. It's just, who's in my town? I'll have to go see them. So we're hoping to add more choices to that atmosphere and really make sure those people are lifted up as well.
And meantime, Ryan, those people who live farther out and away from the medical services that they often need so desperately, it's worth the trip because you guys offer a whole umbrella of services so that even though it might be a longer or more difficult drive to get there, once they arrive, all kinds of things can happen.
Absolutely. Also, part of the services that we're offering to the rural community is what we call telemedicine. And I think it's kind of a growing trend in medicine and mental health treatment for sure, which is being able to access our health center from your cell phone or your computer or your tablet so that if distance or geographic proximity is ever an issue, we have staff that are able to respond to your needs as well.
Don't let distance stop you.
Absolutely.
Telemedicine is a great idea. I know it is, as you said, growing tremendously. 20% of voters say that they have access to telemedicine services. I just saw that this week.
Yeah.
And that indicates an incredible growth. People are accepting of the technology, the fact that you have a doctor or a nurse or some kind of medical professional available in the palm of your hand that you can confer with right then and there is a huge step forward for access.
I know it sounds strange to just think of it, but not going anywhere, and if you're homebound, not having to walk or leave your couch in order to get those vital health services is pretty special, and I really look forward to offering that service more and building on that.
If people were wanting to look into information about Silver State Health,
the best way to reach us is online at www.silverstatehealth.org. We list all of our services, give you an opportunity to take a look at our staff, any upcoming events that we might have, and of course give you directions to how you can reach us. silverstatehealth.org. Ryan Linton is CEO and Executive Director. You talk about being nonprofit, heavily discounted services, access for people, especially if there are things like language barriers, opening the doors and saying, hey, you need some help? Come and see us. Absolutely. How can we fill that niche? And as we mentioned earlier, we're always trying to keep a pulse on what the community tells us to do because we exist for the community. And so we hope as this organization never gets too stale, as it's kind of constantly moving and shaping in accordance with what the community wants and needs. We're really looking forward to being part of the community even larger, making more of an impact and seeing how we can breathe life into Vegas.
Well, Ryan Linden, one of the things you're talking about is just raising awareness of the existence of Silver State Health as medical providers for people who especially need that kind of option. We want to help spread the word. One of the things, of course, that we do as part of Talking Solutions is we always ask, as listeners, what can we do to help you?
I like that. I guess as listeners, what you can do to help us is to really pass on awareness to people in your community that might be experiencing any of the issues navigating the healthcare system that we've talked about today. To really let your family know, your family friends know, your kids at school, that there are solutions that are easy to access. There's free transportation options for people, and there's an opportunity to change the way that healthcare is delivered. There's a lot of talk about universal healthcare these days and people latching onto those words and the sentiment and really where our healthcare system's going. But I would invite anyone that is interested in universal healthcare to really take a look at Silver State Health, because that's kind of the way things should be run. As far as those sorts of plans, it's heavily governmental subsidized, but the quality is much higher for a cost that's much less than you would expect. And so I would invite listeners to explore the opportunities, visit health centers like mine and our colleagues that are also here in the state, and really see the difference.
Wow. All of the services that you offer, including language assistance, the mental health services, especially for groups of individuals who may find that to be very embarrassing and believe that that's the sort of thing you just don't talk about. That's admitting to the world that something is wrong in my house. You know, in order for us to tackle these issues and help solve these problems, we need to have somewhere to go. And Silver State Health is there for whatever your needs are.
It is. And we promise we won't make you wait. We have same-day appointments for all of our specialties because we understand that when you call, it might have taken weeks just to pick up that phone, but you probably need help right now. And so we're always here and excited to help.
How many times when you explain about what Silver State Health is all about, do people go, that is too good to be true?
They absolutely don't know it exists. They feel a little duped that they've bought insurance and not getting that great of care through their other options. And so it's so great to know that some of our most needy members of society are able to access such high quality services. And it is a bit of disbelief myself, even when I got into this, to know that we had so many options in the ways that we're able to deliver care.
Well, you talk to anybody and they're going to say healthcare is right at the top of their list of concerns. And I don't think that people are seeing that there's such a simple option, a different different way to look at it.
Definitely. And centers like mine have been written to existence, I think, in 1972. So they've been around for such a long time and a core part of the U.S.'s delivery model, but so few people really understand what that means and are able to access it. But if you could imagine centers like mine set up everywhere in a country where the country pays for everyone's health care, it would look similar to what we're doing now. And it's amazing to think that quality services can be delivered through the taxpayer's system.
And when you talk about serving underserved or groups of people who don't have any insurance at all, is Silver State Health limited to only those people?
Absolutely not. That's really what we specialize in because we are funded in order to make sure that people who can't pay still receive health care. But that's certainly balanced out by people that do pay us. And so there's always a healthy mix of people who have insurance, whether it be Blue Cross Blue Shield, Aetna, Cigna, Culinary, any of these insurances, to come and enjoy the services as well. Same great services you would receive at your center, just little wait time and a little bit more competent and robust in the amount of services we're able to offer.
It's kind of amazing, actually.
It's fun to be a part of.
Ryan Linton is the CEO and Executive Director of Silver State Health. You guys just have so many services. It's like, as you said, a one-stop shop. Anybody who needs these kind of medical services, this is a great option. And if you know someone who is struggling or someone who doesn't have any coverage or is looking for some help, be it primary care or mental health services, dental, all the different things that you're talking about.
Absolutely.
Please consider Silver State Health at silverstatehealth.org.
That's it.
Ryan, am I forgetting anything?
I am happy to announce that we were recently awarded a grant through the United Way in order to address some of the trauma and concerns that have arisen after the 10/1 shooting. And as part of that, we're wanting to let the community know that if you've been affected either directly or tangentially through this sort of experience, or as we're learning from the community when mass shootings occur throughout the country, it really re-triggers a lot of feelings from individuals in our community because we've experienced the largest in the country, that they have an option in place to go as well. And we've been specifically granted funds in order to reach out to the community and treat all of the trauma that's surrounding that. And so we really invite the community as well that if they know of anyone, specifically anyone that might have any language barriers, that we've been granted funds specifically for bilingual services as well, that there's options for your trauma and there's options for your mental health as well.
silverstatehealth.org. All kinds of choices, all kinds of solutions there. Ryan Linden, the CEO and Executive Director. We'll have information on our Talking Solutions Facebook page, links, plus the podcast of our discussion today. If you yourself don't need services like this, I think we all know someone who really could use the help.
Amen.
So we either need to pass along the information or maybe just give them the link to the podcast. Say, listen for yourself and hear how great this sounds. Maybe you should consider going to Silver State Health.
I would love it.
I think a lot of people are going to enjoy the option. What a great choice. Ryan Linden, CEO, Executive Director of Silver State Health. Thank you so much for joining us today on Talking
Thanks for taking
Solutions.
some time for me.